Hey, imagine losing your most precious memories. Your first kiss. Your wedding day. The birth of your child. For millions around the world, this isn't just a scary thought. It's their reality. Dementia, often called the silent thief, slowly steals these treasured moments. It's a condition that affects millions. Yet, many of us don't fully understand it. Dementia isn't a specific disease. It's a term that describes a group of symptoms affecting memory, thinking, and social abilities. The most common cause of dementia is Alzheimer's disease. But there are many other types. Vascular dementia, Lewy body dementia, and frontotemporal dementia are just a few examples. The impact of dementia goes beyond the individual. It affects families, communities, and healthcare systems. In the United States alone, more than 6 million people live with Alzheimer's. This number is expected to rise. By 2050, it could reach nearly 13 million. The cost of care is staggering. But there's hope. Research is ongoing, and new treatments are being developed. Understanding dementia is the first step. Let's begin this journey of understanding together. Dementia often begins subtly. Its early signs can be easy to miss. Or they might be dismissed as normal aging. But knowing these signs is crucial. It can lead to earlier diagnosis and better management. Memory loss is often the first sign people notice. It's not just forgetting where you put your keys. It's forgetting recent events or conversations. A person might ask the same question repeatedly. They might struggle to remember appointments. Or they might get lost in familiar places. Difficulty with problem solving is another early sign. Simple tasks become challenging. Balancing a checkbook might become impossible. Following a recipe could be confusing. Planning and organizing become harder. Communication problems often emerge. Finding the right words becomes harder. Conversations might be difficult to follow. These language difficulties can lead to social withdrawal. Dementia is a progressive condition. It worsens over time. The rate of progression varies. Some people decline quickly. Others may have dementia for years with slow changes. Understanding this progression is important. It helps patients and caregivers prepare for the future. In the early stages, symptoms are mild. A person might function independently. They might still drive, work, and be social. But they may have memory lapses. They might struggle with complex tasks. Planning a trip or managing finances becomes harder. They might lose things more often. Or they might have mood changes. Depression is common in early dementia. As dementia progresses to moderate stages, symptoms become more noticeable. Independence becomes harder. A person might need help with daily activities. Dressing, bathing, or preparing meals might require assistance. Memory problems worsen. Recent events are hard to remember. Long-term memories might still be intact. But details can be confused. Behavior changes become more apparent. The journey through dementia is often described in stages. These stages help doctors, patients, and families understand the progression. They guide care decisions. But it's important to remember that everyone's experience is unique. Not everyone will experience all stages. Or they might experience them differently. The first stage is often called mild cognitive impairment, or MCI. This isn't always part of dementia. But it can be an early sign. In MCI, memory or thinking problems are noticeable. But they don't interfere much with daily life. A person might forget appointments. Or they might struggle to find words. But they can still function independently. Not everyone with MCI develops dementia. But the risk is higher. As dementia progresses, it enters the mild stage. This is when symptoms start to interfere with daily life. A person might get lost in familiar places. They might have trouble managing finances. Personality changes might occur. They might become more anxious or irritable. While there's no cure for dementia, treatments can help. They aim to manage symptoms and improve quality of life. Treatment plans are tailored to each person. They often combine medication with non-drug approaches. Medications can help with cognitive symptoms. Cholinesterase inhibitors are often prescribed. These drugs boost levels of a brain chemical called acetylcholine. This can improve memory and thinking. Common drugs in this class include donepezil, rivastigmine, and galantamine. Another drug, memantine, works differently. It regulates glutamate, another brain chemical. These drugs don't stop dementia, but they can slow its progression for a time. Non-drug treatments play a crucial role. Cognitive stimulation can help. This involves activities that engage the mind. Puzzles, games, and art projects can be beneficial. Physical exercise is also important. It can improve mood and may slow cognitive decline. Social engagement is crucial. It can help maintain cognitive function and improve quality of life. Support groups can be helpful for both patients and caregivers. The field of dementia research is dynamic and promising. Scientists are working tirelessly to understand this complex condition. Their goal? To find better treatments and, ultimately, a cure. One major focus is on early detection. Researchers are developing new ways to diagnose dementia earlier. Brain imaging techniques are improving. They can now detect changes in the brain years before symptoms appear. Blood tests are another promising area. Some tests can detect proteins associated with Alzheimer's disease. Early detection is crucial. It could allow for earlier treatment and better outcomes. Gene therapy is an exciting frontier in dementia research. Scientists are exploring ways to modify genes linked to dementia. Some approaches aim to reduce harmful proteins in the brain. While still in early stages, gene therapy offers hope for future treatments. Living with dementia is challenging, but there are strategies that can help. These can improve quality of life for both patients and caregivers. For those with dementia, maintaining routines is crucial. Familiar routines can reduce confusion and anxiety. Keep a consistent daily schedule. Use calendars and to-do lists as reminders. Create a safe home environment. Remove tripping hazards. Install handrails where needed. Use labels on doors and drawers. These can help with navigation and memory. Staying engaged is important. Participate in activities you enjoy. This could be gardening, listening to music, or doing puzzles. Social connections are vital. Spend time with family and friends. Join support groups. These can provide understanding and companionship. Stay physically active if possible.